Hello everyone, welcome back to Spine Focus. Many people think that spine surgery should be avoided till the very end and that it should be the last resort. Today I'm going to talk to you about the timing in spine surgery and how it can be the difference between walking and never walking again for a patient. You must never do spine surgery till it gets really bad. This is a very common misconception among patients. Let me share a real life example of a patient from my clinical practice. We had an elderly gentleman in his 70s who eventually came to our OPD bedridden. He had sustained severe pain in his lower back about 3 months back, and this started after he bent forwards to lift something from the ground. He was taken to a nearby hospital where an X-ray was done and a fracture of his spine was diagnosed. It is very unusual for a person to develop a fracture of the spine after just bending forwards and lifting something from the ground. It is important to do an MRI scan in such situations to rule out causes of fracture of the spine due to other causes like infections which could affect the spine, tumors, or cancers affecting the spine. However, in this particular gentleman, MRI was not done as per the request of the patient, and the patient was taken home for home-based treatment and remedies. During this time, the condition of the patient worsened. He became completely bedridden. He developed paralysis of his legs, and in the last 2 weeks, he's lost control of his bladder and bowel. Finally, when he ended up in our clinic, and when we did the MRI scan, we found out that the fracture was due to a cancer that affected his spine, and this fracture was causing a lot of pressure on his spinal cord, which ultimately caused paralysis in his legs. By the time he's reached us, he's already missed the bus. If we had seen him earlier, we would have stabilized his spine, taken a biopsy from the fracture site, and maybe we could have diagnosed cancer early and we could have started treatment early. And more importantly, we could have saved him from paralysis in his legs. And at this point in time, surgery would only help to relieve his back pain and maybe to sit comfortably. And this is exactly why we say time is spine. People often avoid spine surgery till the very end. However, spine surgery is very often done to prevent the disability and not after the disability has already happened. If a patient comes with partial weakness in the legs, some numbness or tingling sensation in the legs, difficulty in walking, the chances of him getting the power back is much better than when you do a surgery when his spinal cord is completely damaged and he's got no power in his legs. This is because all the surgeries that we do are intended to remove the pressure from the spinal cord, and there are no surgeries available to repair the spinal cord which is already damaged. The common cause of spinal cord compression includes infections like tuberculosis. There could be tumors or cancers affecting the spine, or degenerative conditions affecting the spine like disc prolapse. So if you're someone who develops difficulty in walking, losing balance while you're walking, difficulty in buttoning your shirts, if there's clumsiness of your hands, please do not hesitate to consult your nearest spine specialist, because when it comes to spine health, time is spine.